Susan, can you please tell us what are fibroids?
Sure. So uterine fibroids are non-cancerous growths that develop in around the uterus. They're made from the muscle or the fibrous tissue that can vary in size. Sometimes they are small as a seed, but they can get as large as a grapefruit. They're very common, especially in women aged 30 to 50, and often linked to hormones like estrogen.
And how are those fibroids diagnosed?
So your doctor may suspect fibroids during a routine pelvic exam. To confirm the diagnosis, they may suggest either an ultrasound, which is a safe scan that shows the size and the location of the fibroids, an MRI, which is sometimes used for more picture detail, and then blood tests to check the iron levels if you have had any heavy bleeding.
So once they are diagnosed, what are the treatment options available?
So not all fibroids need treatment. It depends on the symptoms and the life stage. So common options include you just watch and you wait. You don't have any symptoms. Then there's medication to manage the bleeding and shrink the fibroid temporarily. Then you have surgery to remove the fibroids or the uterus via myomectomy or a hysterectomy. And then there is the uterine fibroid embolization, which is a non-surgical treatment.
Can you please give us a deeper explanation on the UFE? What exactly is that?
So a UFE is a less invasive treatment which is done by a special doctor called an interventional radiologist. So how it basically works is a tiny tube is guided through the blood vessel, either through the wrist or through the groin. Small particles are ejected to block the blood flow to the fibroids. The tiny fibroids then shrink over time and then your symptoms improve. There's no big cut, there's no stitches. Most women go home the next day and recover within a week or two.
Are there any common questions or myths regarding the fibroids and the UFEs?
Absolutely. So one of them is, are fibroids cancerous? So the answer is simply no. Fibroids are not cancerous, they are benign growths. The other one is, will they burst? Fibroids do not burst like a balloon. They can grow and they can shrink, but they cannot explode. Another one is, do I have to remove my uterus? And the answer is simply no. Many women find relief with surgery, especially with the UFE and the medications. And the last one is, will they come back? And there the answer is, the UFE shrinks the fibroid permanently, but new ones can sometimes form. And that's true for almost all treatments except for a hysterectomy.